little reminder every once in a while to help keep ourselves healthy.
There's an event next week where you get a chance to find out ways to take care of your heart. And Dr. Michael Dickinson with the Spectrum Health Medical Group is here today.
And today we are focusing in on heart failure. And so, Dr. Dickinson, why don't you just tell us what heart failure actually is?
Sure, I'm a specialist in heart failure, which means I take care of patients who have symptoms because their heart's not able to keep up. So they oftentimes can have shortness of breath or swelling in their legs, or oftentimes feel tired.
Yeah.
Okay.
So let's talk about some of those causes, because obviously that's something that we want to avoid. How can people?
Sure, the most common causes of heart failure are high blood pressure is the number one cause, heart attacks. Some viral infections can cause heart failure, and occasionally it's an inherited condition.
Okay, so there are some things that we can control and some maybe that are a little harder to control.
Yeah, absolutely. So some people that get heart failure, it takes them by surprise, comes out of the blue, the young person with a viral infection or a cardiomyopathy. Other people have had years of high blood pressure or diabetes, and so to prevent it, it would be taking good care of yourself. Treating your high blood pressure, treating your diabetes, going to your doctor, taking your medicines, exercise. Low salt intake. Americans take in too much salt. If we would all take in a little less salt, high blood pressure would be less of a problem.
Yeah, and you talk about some of these medications that really can help you reduce your risk factor, correct?
Oh, absolutely. So, you know, the most important thing we would say is go to your doctor, get your checkups, take your medicines for your high blood pressure, diabetes, high cholesterol, whatever conditions you have. Once you have heart failure, it's very, very important that you take your medicines. I went into heart failure because research showed that many patients, if they take their medicines, get better and have a really good quality of life. Most patients don't end up needing artificial hearts or transplants or anything like that.
Just wondering, for people that are watching, is it something that comes on very slowly, or is it something that is more sudden? Do people really know when they're starting to experience heart failure?
You know, it's interesting that you say that. Some patients, especially young patients, don't even know that they have it, and they think they may have bronchitis or a cold or a flu, and they go through varying treatments until eventually their doctors or they figure out that there's something wrong with their heart. So it can come on slowly. Like we said, patients that have unexplained shortness of breath need to be investigated, or if they have chest pain, obviously they need it. Swelling in the legs needs to be investigated, and then sometimes it's just fatigue or tiredness, and we use the expression go red for women. Women oftentimes present with heart disease as just tiredness as a sign.
And their moms and dads are experiencing it too, and so you never just really think that maybe there's something else going on.
Right. If you can't explain what's going on with your body, you need to talk to your doctor.
And you know, it is interesting because you talk about being able to talk to your doctor. A lot of us, you know, fortunately may have good relationships with our doctors and we can ask those questions. But you at the Spectrum Health Medical Group, I love it because you have these programs called Doctor Dialogue. You actually make it really easy for folks to connect with you, and you have one coming up next week.
We do. March 14 at the Prince Center at Calvin College, we're going to do Doctor Dialogues, where we'll have 4 heart experts discussing a variety of issues related to heart and vascular care. And these are wonderful events because it opens an opportunity for the public to hear what we have to say, but also to interact and ask questions.
That's very interesting, because seldom do you get the opportunity to have an audience with 4 different heart experts. And so if you know that there is an issue, or if you're concerned about somebody that may have an issue, it's great to be able to go to that open place, no pressure, to be able to ask and to listen.
These are wonderful events. When I've done things like this in the past, it's been fun. Everyone I know, everyone will have someone in their family or their friends touched by heart failure. It affects 5.5 million Americans. When we do these events, there's almost always very pertinent and relevant questions.
Yeah, I always think it's interesting too, because as you touched on, women may present with such different symptoms than men, and we have to think that when it comes to the sexes, we're not always equal when it comes to those symptoms.
Traditionally in research trials, it was men that participated in the trials, and now there's a greater effort to try to look at what symptoms look like in women. Women don't necessarily get the classic chest pain symptoms of a heart attack, and so fatigue and tiredness, or decreased exercise tolerance, inability to do the activities that you used to do, could just be that you're tired and you're working too hard, or it could be there's something seriously wrong with you.
Yeah, and if you have additional questions, please contact Dr. Dickinson. His information is right there there on the screen, and we'll put it on our website as well. Thank you so much for coming in, letting us know about this opportunity that's taking place next week.
Well, thank you for letting me share with you and for raising awareness.
Fantastic. Thank you.
We'll be right back.
That's West.